Yesterday, we had a spectacular introduction to this conference and to the full range of issues that we will be exploring for the next 3 days. We saw videos, very powerful videos last night, and even equally powerful videos that the students produced that reminded us of the critical issues that we are dealing with. We heard from the First Lady of Pennsylvania and her concern and the governor's concern for women's health in this state. And we heard from President Amy Gutmann, who's of the University of Pennsylvania. And she brought us a very, very important message. She brought us a message of the necessity of empowerment, of the empowerment of women in this day and age. It is up to us today, tomorrow, and the next day to really explore what the implications of empowerment are in the fields that we are most concerned with, the fields that we have been brought together to deal with in this very special conference. And that is the confluence between women's health and cities and urban life. And that's what we'd like to review for a second this morning. We know that 50% of the population, we keep hearing the statistic, is urban. And we know that at least 50%, if not more, of those are women. And we know that if you live in the city, you have a right to the city. And what does that mean, having a right to the city? This is how we're going to define empowerment. A right to the city means that you have the right to have all the privileges and the services that a city should offer. Women have a right to decent housing. They have a right to go to school. They have a right to a secure job. They have a right to raise their families in healthy surroundings, free from violence and crime. They have a right to determine their own health decisions. Do you know that in 50% of the women, 50% of the women in the world who are married do not have that right? They cannot determine their own course of health. So our duty today and the days that follow will be to be looking at this right and how it is explained in our fields. Today's focus is going to be on urban space and its relationship to health. And I define that in particular as looking at the form of places, looking at the standards, the minimum standards that we expect to have these places have. What is decent housing and decent shelter? Of the kinds of facilities that our cities should have. Where are the health clinics in our cities? The right to mobility, to move through that city, to get to the facilities that women need to protect their health. So these are some of the questions that we will be looking at. Now, to help us look at these, we have two people right this morning. First, we have Marilyn Jordan Taylor, who will be introducing our keynote speaker. And Marilyn Taylor herself is well versed in the right to the city. An architect and urban designer, she is known for her passionate involvement in urban design projects and civic initiatives, as well as for the leadership that she has exercised in some of the most complex decades of practice as her partner in Skidmore, Owens, and Merrill. She became dean of the School of Design at the University of Pennsylvania last year. And she will tell you a little bit about that. But let me tell you a little bit more about her so you understand why I say she understands the right to the city. She has been deeply engaged in civic leadership. She currently serves as a board member on the Delaware River Waterfront Corporation, which we dearly hope will open up more open space for women for exercise. You remember those two little girls last night who said, "Where's the free gym?" You remember those two little girls who said they couldn't walk safely in their neighborhoods? Well, Marilyn's going to help them walk safely in their neighborhoods. She has had many distinguished leadership positions. I'm just going to point out two. One is she served as the chairman of the New York Building Congress. I think she may have been the first woman to be in charge of all those contractors. Is that true, Marilyn? And secondly, she led a very important civic effort after 2001, which was the formation of New York New Visions, which gathered together hundreds of designers to help advise the city, the state, and the nation on what kind of city-friendly principles should exist in the reconstruction of the World Trade Center. Ms. Taylor received her education at Radcliffe College and at the University of California at Berkeley, and she joined SOM in 1971 and was elected partner in 1985, and before you knew it, she became the first woman managing partner of SOM. But more important has been her practice over time, and something that you all can witness and participate while you're here in the United States. And that is the transformation of the Northeast Corridor, our rail system that goes from, well, for our purposes, from Washington to Boston. It goes elsewhere. But her ability to envision and reconstruct and show those railroad people what was needed with regard to open, fresh stations, accessibility to mobile transportation was singular. So when we asked her to talk about women's issues in space and design, she can do that very forcefully. But her job today is not to do that, unfortunately. Her job is to introduce our next speaker, Melanne.
Good morning, everyone. As you can tell, there is absolutely no better partner in New York, in Philadelphia, at the School of Design for understanding and expanding the sense of right to the city than Jeannie Birch. Thank you very much for that wonderful introduction, Jeannie. Well, it is indeed my great pleasure to be here this morning among so many amazing women. You have focused much of your lives, and you're here now focusing for 4 intensive days on the subject of women's health, convened by, of course, the incredible and extraordinary Dean Afaf Melisse. Afaf, thank you so much for having us all here together. The subject, as I've reviewed your materials and looked at the abstracts and thought about the amazing amount of material you are covering together, is a truly incisive look at urban planning with a keen eye on its particular potential for better supporting women's lives and women's well-being. As the world grows more urban and as more people seek urban life as a place of employment, opportunity, and mobility, thank you for the plug for high-speed rail in the Northeast Corridor, we need it, the process and facts of urbanization do indeed very often place the heaviest burdens on women. What can we share with each other of our understandings of the causes and consequences of this inequality? What can we learn from each other to foster improved health, safety, social development, and prosperity for women in urban locations around the world? Well, urban planning comes in many forms. It addresses systems, small and large. It certainly addresses services, often too inaccessible. It operates at many scales, neighborhoods, districts, regions, and megaregions, and at the same time, it's extremely personal. It goes to households, family, friends, and networks, all very important if we are to make a difference in women's lives. My assignment, as my assignment, is to welcome you here for this conference from the School of Design, one of Afaf's partners in this. I would like to introduce you, however remotely, we're only 2 blocks away, and we would welcome you to come down for a visit, to the planners of our school and what they're up to. We are a graduate school in planning for over 160 graduate students and 25 PhD students who are learning the skills of land use planning, land conservation, economic and community development, environmental design, and transportation planning. Very importantly, they sit in close proximity to another 440 students in architecture, landscape, urbanism, historic preservation, urban design, and the fine arts, cultivating their individual skills while learning the different ways of thinking in allied disciplines, the allied disciplines that as designers are very important to us when we take on complex problems. They have amazing commitment and resilience that embodies a belief I have long held, a belief in the power of design, a belief in the power of design to influence, enhance, and make better the life of all people. I believe, as someone coming relatively new to the academy, that theory and practice share common cause, that ideas, not algorithms, however beautiful and powerful those algorithms may be, lead to design that makes a difference. I believe that artists and planners and designers have a responsibility to express and affect their societies and communities, and that the voice of art and design is essential to public debate and to advancement of the goals of quality, equity, sustainability, and women's rights. When women don't speak, others do. When designers don't speak, others do. I am delighted to be here to raise my voice with yours. The need for designers across all disciplines within design to engage in issues relating to women's health has never been more challenging and important than it is today. Even as we face the fact, all of us in different ways in our societies and economies, all of us face the fact of dramatically reduced resources for addressing these issues. We have to be even more energetic and even more clever. Here at Penn, at the School of Design, as faculty, students, researchers, and people concerned with the issues of health, well-being, quality of life, and equity, we have many activities going on. I'd like to just share snapshots of a few. We're devising systems to put healthful food within reach of all urban neighborhoods. We're enhancing the walkability of our cities and explaining, especially to women, how to make use of it in their daily lives. We are designing and building, at school, we are designing and building affordable housing for mothers with children in West Philadelphia, now admittedly at small scale, but the very rewarding scale of 6 units at a time. We're devising a system, again, in pieces, that brings clean water to Dhaka neighborhoods. And we are in the hands of a wonderful husband-wife team of Anu Mathur and Dilip Takuna. We are seeking to understand the urban water system in Mumbai, where there's sometimes too little, sometimes way too much, and explaining new ways to think about it and to find new ways to use it. Design as education is a great way of thinking, a great way of problem solving, and we aspire to make it useful to you. Now, turning to today, our keynote speaker this morning is a woman who certainly raises her voice very well. President Barack Obama appointed Melanne Verveer as the United States Ambassador at Large for Global Women's Issues. What a challenge. The President's decision to create this position is unprecedented and reflects the elevated importance of these issues to the President and his entire administration. In her capacity as Director of the Department of State's new Office of Global Women's Issues, Ambassador Verveer coordinates foreign policy issues and activities relating to the political, economic, and social advancement of women around the world. She mobilizes concrete support for women's rights and political and economic empowerment through initiatives and programs designed to increase women's and girls' access to education and health care, to combat violence against women and girls in all forms, and to ensure that women's rights are fully integrated with human rights in the development of U.S. foreign policy. Ambassador Verveer most recently served as chair and co-CEO of Vital Voices Global Partnership, an international nonprofit she co-founded. Vital Voices invests in emerging women leaders and works to expand women's roles in generating economic opportunity, promoting political participation, and safeguarding human rights. Ambassador Verveer has a BA and MA from Georgetown. She is a member of the Council on Foreign Relations, the Women's Foreign Policy Group, and numerous other organizations. Her keynote today will address women's health 15 years after Beijing, progress made. I know we all look forward to hearing what she has to tell us. Please welcome Ambassador Melanne Verveer.
Good morning, everybody. It is such a very special pleasure for me to be here for ICOWHI's 18th Congress and to be with so many of you who do so much each and every day around the world to improve the health of women and girls and the quality of their lives. I think it's extraordinary that this gathering is focusing on women's health in the urban context, because today the movement increasingly is into cities around the globe, and they are teeming as never before. And so the challenges for the delivery of health care, among other challenges, are indeed great. From the first moment when Dean Mellis called me, she was absolutely relentless in making sure that I showed up. No matter what excuse I gave her, as legitimate as they were, including leaving on a trip to go overseas today, she said, no, you just have to come. So I have concluded that if her relentless nature is typical of ICOWHI's work, we are well on our way to making even greater progress on women's health. I think it is also fitting in many ways that this meeting of your Congress is taking place here at the University of Pennsylvania, which was the home of our country's first medical school, the first teaching hospital, and a place that enjoys world-class recognition for its role in this health field. A university that truly has a global reach, a place that is both a very informed and very caring global citizen. I understand that President Gutmann spoke to you yesterday, and I was interested that in her statement about the mission of this university under her leadership, she said that it be just not a global leader, but also a dynamic agent of social, economic, and civic progress. And that's what I think we all need to do to tackle the many challenges that confront women's health. I want to acknowledge Dr. Julio Frank, who is here from Harvard. He and I have had the pleasure, certainly been my pleasure, to serve on panels together. But I think I want you to know that he has set the gold standard for what a minister of health needs to be and needs to do when he had that position in Mexico. So you are into a great treat having him. I'd like to give you an overview of women's health in the broader context of women's rights as human rights. We are gathering in this year when we mark the 15th anniversary of the 4th UN World Conference on Women that took place in Beijing. We are also marking the 10th anniversary of the Millennium Development Goals. Now, Beijing produced a platform for action which 189 participating countries adopted by consensus. It is a blueprint against which we measure progress for women and girls in our own country and all around the world. The 8 MDGs have measurable targets for advancing development and reducing poverty by 2015. Not far off, and we have a way to go. Beijing's platform for action and the MDGs are linked together, inextricably linked together, because gender equality, a goal in and of itself of the MDGs, is also the means toward which we will achieve all the MDGs. This then is a time when we come together to measure the progress we have made and to focus our efforts more sharply towards the realization of women's rights as human rights and the equality that women must have with men to move forward in this world. The Beijing platform and the MDGs call us to action, and that Beijing platform made a call to action out of women's access to health care and education, out of the freedom to be violence-free, out of the right to enjoy equal rights, out of the right to participate fully in the economic and political life of our countries. And all over the world, women have been blazing new trails and triumphing over long entrenched obstacles. Today, we see progress as violence against women is criminalized, but those laws need to be better implemented and enforced. We see the age of marriage being raised. We see more girls in school. We see more mothers who are HIV infected able to get the drug to prevent the transmission of that infection to their babies. But as Secretary Clinton said, progress is not the end of this story. It is only the beginning, because now we must write the next chapter to fully realize the dreams and potential of Beijing. As you heard from Marilyn, the position that I hold is unprecedented for our government and is a demonstration that the President, the Secretary of State, are deeply committed to incorporating women's issues in all aspects of United States foreign policy, because it is a simple fact that no country, no matter where, can get ahead if half its people are left behind. If the potential of women and girls is to be fully developed, and women and girls are to participate fully and equally in their societies, we will see great improvements, certainly in their families and in their communities. But we will also see great progress in their countries and great benefits to our world as a whole. Now, unfortunately, the potential that women and girls represent for the future of our world is still largely untapped. I believe we can no longer relegate this global imperative simply to the category of women's concerns. You know, those nice issues, put them on the side. We've got far more pressing issues to address. Well, there are no far more pressing issues than these. They are among the toughest that our world confronts, and they will say a great deal in terms of how we address them about our collective future. Or to put this as Senator Clinton did, Secretary Clinton, until women around the world are accorded their rights and afforded the opportunity for education and health care and jobs, global progress and prosperity will have its own glass ceiling. And no one knows this better than all of you. No one knows the challenges to health care better than you. We know that improving health care for women also improves the lives of their families and communities. Yet I regret to stand here and say that progress since Beijing on women's health has not been as significant as progress in other areas. When now Secretary Clinton gave the keynote address in Beijing with those stirring words about women's rights as human rights, she also participated in a panel on health. And I went back recently and read her remarks from 15 years ago. And I was stunned because what she said then, she could just as easily say today. Not so much in terms of the analysis of the problem or the facts as we know them, but in terms of how little progress we have made since she uttered those remarks a decade and a half ago. MDG 5 pledged a 3/4 reduction in maternal mortality and universal access to reproductive health by 2015. Yet today, a woman dies in childbirth every minute somewhere around the world. Reduction in maternal mortality has been too slow and almost negligible. While he has been fighting for health care reform here at home for the American people, the President also has advanced a very ambitious global health initiative that puts a major emphasis on a commitment of resources to ending maternal mortality, greater access to family planning, and improving women's access to a continuum of care. Focusing on women and girls is the right thing to do because their unmet health needs are so significant. Because of women's reproductive role and the patterns of gender discrimination that are ever with us, the world's women and girls bear a disproportionate share of disease, violence, and mistreatment. The global rate of maternal mortality is truly unacceptably high. Every year, an estimated more than 500,000 women die from largely preventable complications. And for every woman who dies, 20 more suffer from injury, infection, or disease. 99% of maternal deaths, disabilities, and all of these kinds of health concerns arise in the developing countries. Most of the deaths, for example, in sub-Saharan Africa, where there has been so little measurable improvement at all since 1990, remind us of the road we have yet to travel. A woman in Africa may face a 1 in 26 lifetime risk of death during pregnancy and childbirth, compared to a 1 in 7,500 risk in developing regions. This divide is greater on maternal mortality than all the other issues covered by the MDGs. Now, this is not to say clearly that we do not have our concerns in richer countries like our own, where we see differences in maternal mortality. I come from Washington, D.C., and they are clearly there, predominantly because of income disparities and other kinds of factors. So we cannot rest wherever we live. Of the over 500,000 deaths to pregnancy and childbirth that take place every year, an estimated 34% stem from unintended pregnancies. Yet over 200 million women still lack access to modern forms of contraceptives. If we spent more on family planning and maternal health, we would cut unintended pregnancies by well over 2/3. I remember years ago visiting a public hospital in Salvador de Bahia in northern Brazil, and the health minister of the province took us through. I was with then First Lady Hillary Clinton, and there were the rooms of joy that I remember so vividly. New moms cradling their babies, learning the kangaroo method. And then we were told about the great suffering that was also taking place. The women who hadn't had access to proper treatment during childbirth, or who were trying to terminate those births because they confronted a world that was so terrible in so many ways. And I've never forgotten what the doctor said. He said, you know, it's not right that these women don't have the access to what richer women have every place. And that disparity is so strong in so many ways. AIDS is the leading cause of death among women aged 15 to 44 worldwide. And in sub-Saharan Africa, 61% of all adults living with HIV are women. Today, the face of AIDS is the face of a woman. And the spread is associated with social dislocation and violence against women. And the infection rates are still climbing at an alarming rate, particularly among adolescent girls. There's been good news, too, because prevention of mother-to-child transmission, for example, has increased incredibly. Some 50% now coverage is available. Life has been extended dramatically by retroviral drugs. But we have a very serious continuing problem that largely focuses on women in so many ways. Statistics like these demonstrate that the dire needs of women throughout the world are still too often overlooked. And even where health services are available, the poor socioeconomic, educational, political, and legal status of women and girls can prevent them from accessing these services. So it's clear, it is right to focus on these issues. It is the right thing to do. But it is also the smart thing to do. Women's health is not only for women themselves, as critically important as that is, but it's for the entire family. According to WHO, some 1 million children are left motherless each year, and these children are 10 times more likely to die within 2 years of their mother's death. We know that women the world over are primarily responsible for the care of their families. They are in charge of managing water, nutrition, household resources, and they serve as the conduits to health care for their families. So the ability of women to access health-related knowledge and services is fundamental to the health of babies, to the health of older children, to family members, and to the broader community. Improving the health of women and girls also enhances the productivity and social and economic participation and acts as a multiplier benefiting the development and health of future generations. When women and girls have access to health care services, they are valued more, they enjoy legal rights and protection, and are educated and likely to have smaller families, healthier children, longer lives, with overall long-term benefits to their communities. This is why we know from all of the data that accumulates by the day, much of it from researchers like yourselves, that the most effective development investments that can be made are those made for women, because from those investments stem greater poverty alleviation and greater prosperity for countries. So for these reasons, the Obama administration's Global Health Initiative is focusing on a women and girl-centered approach in several ways. First, we are increasing support for programs that serve women and girls, including maternal and child health, family planning, and nutrition programs. Secondly, we are supporting long-term systemic changes to remove the economic, cultural, social, and legal barriers to healthcare services and to increasing the participation of women and girls in healthcare decision-making. And third, to do this, we need to do it through high-impact interventions, developing and strengthening health systems, addressing social and behavioral determinants of health. All of these are critical to saving lives and reaching women and children with equitable, effective, and sustainable care. The dire state of women and girls' health in many parts of the world does not stem from uncertainty about how to save their lives. We know that providing proven, evidence-based interventions such as skilled birth attendants, access to emergency obstetric care, pre- and postnatal care, access to family planning will save women's lives. We know what works. I have visited urban hospitals from Moscow to Mumbai, and I am always impressed at what can be done, even in some of the most difficult circumstances, to provide an integrated series of services. Bangladesh, one of the most challenged countries in many ways, has focused on building essential obstetrical care capacity, and it has seen rapid declines in maternal mortality. In Dhaka, where I was not too long ago, in its urban center, I saw firsthand what healthcare training can do. I saw an innovative project where parts of the city were divided up, and every effort was made to be in contact with mothers who were pregnant, to learn their histories, and to make determinations early on about those who could potentially be presented with complications down the road. Those early on were moved into a tertiary care setting to get the kinds of treatments they would need to help them. Now, these centers were very, very modest places, but they were places where the complications could be adequately addressed. They were the places where lives were saved. They were the places that were providing integrated quality care. In Indonesia, in one of the poorest parts, I wondered why certain doors in a neighborhood were marked the way they were. And I found out that through a neighborhood health process, health delivery process, those were the doors where there were pregnant women. And those were the places where the neighborhoods rallied to ensure that she was doing well in each and every case, and that if complications were presenting themselves, they were aware of what they were, and they were determined to make sure that that mother was going to get the care that she needed. So we need to strengthen our health systems to better respond to women's health needs. For example, by ensuring an adequate supply of trained health providers and adequate health facilities. We also need to ensure that maternal and reproductive health care is integrated throughout our health care programs. A pregnant woman who seeks HIV/AIDS treatment to prevent mother-to-child transmission of the HIV virus, for example, should have access to family planning information and pre- and postnatal care. But we all know the situation where a woman who's fortunate enough to be able to get the drug to prevent that transmission oftentimes will leave the place where she got that treatment not access family planning, and not access the kind of care that she and her baby need. This is what we are working to change. We also need to address those myriad economic, cultural, social, and legal barriers that impede women's access to health care. The unacceptably high rate of maternal mortality is directly linked to persistent gender inequalities, including gender-based violence, harmful traditional practices such as early forced marriages, the lack of education, the lack of economic opportunity, and unequal access to health services and facilities. Adolescent girls are among the most vulnerable, and serving adolescent girls adequately is one of the most neglected areas of emphasis that we need to change. They represent high risk for early pregnancy and motherhood, yet the birth rate is highest among them in sub-Saharan Africa. And just as I have heard about those girls here who talked about the ever-present violence in their lives, I heard so many times from girls in Africa where they told me vividly how every moment of their lives, from times in their homes to their classrooms to all the spaces in between, they feel so vulnerable. In South Asia, early marriage contributes to the inability to reduce maternal mortality rates. Risks are high for both mothers and child when pregnancy occurs at a very young age. And incentives to keep girls in school where they belong and out of early marriages is absolutely critical. I heard about a girl whose father came to her and said, "It's time for you to be married." She's very young, adolescent, really a child. And she said, "No, Daddy, I don't want to be married." She was in school. She had participated in a program to keep her in school where there were incentives to families and to the girls to enable them to stay in school. In her case, she was given a cow so that she would not have to stay out of school to do the kinds of chores that were required for the ongoing needs of the family. And when her father broached marriage to her and said he had already arranged everything, she said no. And he said yes, and she said no, and then she said, "But then if I have to go, I'm taking my cow." And he said, "No, the cow belongs to the family." And she said, "No, the cow belongs to me, so I could stay in school." And as this went back and forth, that father, who did not so much see the worth of his daughter, which is a problem for girls the world over, understood the worth of that cow and spared his daughter an early marriage because he could not afford to lose the cow. So whatever it takes, we need to ensure that girls are protected, get to stay in school, have the knowledge that they need to take care of themselves and their families in the future, and are going to be so much better off when it comes to their prospects for employment and the kind of future mothers that they will be. So MDG 4 addresses child survival. And we know that child survival is dependent on a mother's health and her role and status in her society. MDG 5 addresses maternal health. And we know we've got a long way to go. MDG 6 addresses HIV/AIDS, malaria, and other diseases. And we have made some progress, and have much more progress to be made. And I want to touch just very briefly on MDG 8 because it addresses environmental sustainability. And much of the context that you have set out here in terms of the urban challenges really focuses on this as well. Safe drinking water, basic sanitation, the impacts of pollution, and all the consequences of climate change that we are understanding better and better today. Women have a critical role to play, both in adaptation and mitigation of these situations. Whether it's the kinds of cook stoves they use that are affecting their health. I was visiting a area outside of Delhi not too long ago, and after being with women there for several hours, I realized I couldn't swallow and my eyes were burning. And so much of this had to do with the way that the women were cooking every single day, and not only harming their health, but the health of their families, and clearly beyond that, because there are no borders to these kinds of problems. Recycling and better ways to engage in farming, and we know that the great majority of farmers today in the world are women, between 60 to 80%. So our work is far from done. As Secretary Clinton has said, that I mentioned earlier, it is up to us to write that next chapter to fully realize the dreams and potential of Beijing. So let us recommit ourselves, as I know you will do, in the process of this Congress. And let us recommit ourselves to that platform for action. Because women's rights are human rights, and we cannot settle for anything less. I thank you for all that you do. I thank you for all that you will do. And I wish you Godspeed. There was, since the 90s, an office at the State Department that devoted itself to addressing women's issues. It actually started during the tenure of Secretary Albright, and then was continued through the Bush administration. In the 90s, when now Secretary Clinton was First Lady, as many of you know, she devoted herself at an extraordinary level to women's global issues, visiting some 75 to 80 countries and working on the range of the Beijing challenges. And worked very closely with that office, in fact, and many of the initiatives that were taken, whether to deal with microcredit or health advancements or addressing a range of other related issues, were stemmed from that time. But I think there was a recognition clearly that the moment was with us. When we realize that these are absolutely critical issues to the future of our world. And a decision was made between the President and the Secretary that we needed to do more, and America had to send a strong signal that these were issues that needed to garner the kind of attention, and not marginal attention, but central attention. So part of my role is to really integrate women's issues in the overall work of the State Department, whether it's economics or whether it's what's happening in the regions or whether it has to do with human rights, that these are understood, these focuses on women are understood to be central to the outcomes of the overall decision making. You know, as I stand here, I'm reminded, I don't know how many of you have read Nick Kristof's book, Half the Sky. And in that book, he said that the moral imperative of the 19th century was ending slavery. And the moral imperative of the 20th century was our struggle with totalitarianism. And the moral imperative of this 21st century has got to be the equality of women. And so all of that comes together in explaining why these issues have to be central.
Thank you very much for the work that you do in the world and for being here with us this morning. I'd like to ask you if you could help us reflect on some of the strategies that you are using, that the U.S. is using globally to change that fundamental system of valuing women. And it is stunning to hear you talk about the value relative to a cow. But nonetheless, I think that is a wonderful reminder for us and a horrible reminder for us of how we are seen as a gender in much of the world.
I think that whether we're working on healthcare or we're working on economic opportunity for women, fundamentally we're dealing with problems that come from the low status of women and the lack of worth of a girl. I don't know how many of you saw the Economist magazine a couple weeks ago, and it screamed out on its cover, gendercide. And it was about the fact that girl feticide and girl infanticide are very, very pronounced, particularly in places like India and China, and reflect on the low status that a girl has in certain cultures and societies. And what this represents in and of itself is a pretty terrible thing to comprehend. But it is also now so skewing the demographics between men and women that it is completely off kilter and going to have even bigger consequences for those societies. But in a way, it is a reflection of what I said about that girl, and she was in South Asia. We have to do what we can to raise the status, and that's where the strategies lie. I believe that women's economic empowerment is so critically important because I've seen in the data, and I've seen firsthand, the correlation, for example, in the worth a woman has, maybe in owning that milk cow, because that brings income to her family. Her family's life is transformed, and she is at the epicenter of having made that happen. The violence goes down. Her access to a better life for her children, who hopefully can access school. The health needs that are addressed. So it's a range of interventions. It is also interesting that as we are working on violence against women and girls, which is a pandemic, and I don't know if you're aware, but in the last month and a half or so, both the Senate Foreign Relations Committee and the House Foreign Relations Committee each have held hearings on this global phenomena because it is a tremendously huge violation of human rights, but it is also a productivity issue. It's a health issue, the consequences to AIDS infection, et cetera. And it is harming societies and individuals in indescribable ways. So the strategies, I think, have to focus fundamentally on what we know best. Education. You know, when Mukhtar Mai was gang raped in Pakistan, in this village in Pakistan, she went on somehow to muster the strength to take her case to a local court. She was rejected the first time. And this poor illiterate woman, managed to try again. and she won a very small settlement. And she took that money and she built 2 schools, one for girls, one for boys. She enrolled herself in the school for girls. And when asked why she did this, she said, because nothing will change where I come from unless there is education. Education, economic empowerment, and all the strategies we have put together to provide incentives to get those girls in school, incentives to enable women through microcredit and other means to transform their lives economically. All of these things are really going to create better and greater access to the kinds of issues you're confronting in this Congress.
Hi, thank you for the presentation. My question is, what kinds of opportunities are there for nurses or nursing students who are interested in working in some of the initiatives of this program?
Well, I think there are lots of opportunities, clearly, because the skill set that nurses bring are vitally needed to addressing these issues on so many levels. I know many of you are doing that, whether it's through your research, whether it's through your practices, or whether it's through your impacts on policy. But there are also ways to engage, and the best way is what this represents, an organization that has a mission and commitment to what you are all doing. But I would focus on those opportunities, and I don't know if you're talking about practice on a local level or you're talking about public policy. But one of the things we have today is not a lack of opportunity in that direction. Everybody's talents, commitments, experience are really vitally needed and can be channeled in any number of ways, either at home or overseas, to begin to bring greater positive outcomes to the problems that we still confront.
Good morning. I'm Marianne Hattar, and I thank you for a very informative presentation. As you addressed criminalizing violence against women, I'm reminded of changes that happened in certain countries to that effect. But as we look at G8 and looking at these indicators, I'd like to make the point that as what appears on paper to be changes in the criminal system to prevent violence against women, yet the social context still absorbs it and does not really enforce these. How the G8 will take these and look at it more qualitatively rather than by just simple indicators that changes have taken place on paper?
That's a very, very good question and a very profoundly important observation. And we do have to continue to get these issues on that G8 agenda. For example, this whole issue of maternal mortality was very significant in the preparation for the G8 this year. Canada, the United States, and other countries came together, and I think that's going to move the potential for greater progress forward. So these bodies of critical players on the world level need to be looking at these for the important steps that can be taken. With respect to violence against women, we need to get that clearly on the agenda. I would say if you look back over the last couple decades, this was an issue that was nowhere. It was the women in Africa who brought this to the Women's Conference in Nairobi, which is the conference right before Beijing. And it was put on that agenda, and it was put on because these no longer could be viewed as private matters, which they were. They were the requirements of governments at whatever levels to address as harmful public human righs issues, and they needed to be criminalized because they're not cultural. It is a criminal behavior that cannot be not addressed. And one of the things we see the world over is where there is no deterrent, this goes on and on and on. But that's just one aspect. And you're exactly right. We have laws on the books, but those laws in many places are not enforced. They are not implemented. And I think that is one of the tremendous needs that people have to address and come together, men and women. We really need to engage men. We need to engage religious leaders who have a lot of clout in cultures where this dominates, and come together to really make these laws work, number one, but also work at changing awareness and attitudes and those kinds of behaviors as usual that can no longer be tolerated. So there's the law enforcement piece, there's the criminalization piece, but there's also the prevention side. And I think we've got to devote ourselves knowing what we know about how this happens, where this happens, to one, work at alleviating poverty, because at its root it makes women and girls so much more vulnerable. But also awareness. I cannot overstate the importance of awareness programs to make people understand what is happening and what has to happen to stop it. And then we also need the protection piece. What are we doing to take vulnerable women and girls and make sure they're going to be safe? So prevention, protection, prosecution, and I would add, and making it a priority, prioritization. So you're right, we need a realm of interventions at all of these levels, and we need for this not to be just the rallying cry of that NGO struggling every place in the world, but we need for it to be on the top agendas of our leaders. And I think that's the fact that in our Congress that the two major foreign relations committees have taken on this issue is very significant for us.
Good morning. Yes, and I would also want to extend my gratitude for all that you're doing, and also thank President Obama for making women's health globally such an important issue, and because certainly it is, as you've identified. I'm a psychiatrist by training, and so obviously when I come to women's health, I think of it from the brain perspective and the mental health perspective, and so many of the things that you talked about today I know are basic, keeping women alive, and so sometimes when you're really focusing on maternal morbidity, for example, or HIV/AIDS, you're really thinking about their medical care. But when I hear about violence against women and some of the sequelae that I know that these young women must be experiencing when they're marginalized, or they've actually been traumatized, and I just wanted to know, is women's mental health on the agenda at all? At a more sort of basic level, of focusing on sort of post-trauma and intervening at that level as well.
Absolutely, and you remind me, having been part of the efforts in our own country in the previous administration to get health care reform, what a huge part of the discussion and debate it was to make sure that mental health and the way we non-health practitioners see all the rest of health as something not separate, but totally part of a whole. So the necessity for all of that to come together in treatment is absolutely critical. In violence against women, dealing with trauma, the counseling piece, the coping with what has happened, and the healing process, and being able to surmount what has occurred and move on with one's life are essential to dealing with it. So what you said is indeed very basic. There are places in our world where rape is used as a tool of war. The combatants, the armed combatants in Congo and DRC, for example, know that their strategy, the one that they pursue, is to go in and to brutalize the woman, and in the process destroy her family, destroy the community, and they have succeeded in what they intended to do in terms of their strategy. The women who have to live with what has happened to them desperately need the counseling, the dealing with the trauma, the coming to grips with what's happened to them, the healing, the mental healing. And that is one of the essential pieces of all of the programs that are being done, not just in DRC, but in dealing with violence against women more broadly, because one is forever violated in ways that one can never transform her life unless the piece that you mentioned is addressed. So thank you for that.
I'll be brief. I want to thank you also for an excellent presentation. I wonder if there are ways that we can contact you and learn more about the work that you're attempting to do, and if there's ways to get copy of the presentations, the paper you presented and that others will present at this meeting, perhaps in the form of proceedings or a book.
Okay. Well, what I have now is a bunch of scribbles, but we will make sure we transform it into something readable, and I'll get it to my persistent friend here who stayed after me to get here today. So we'll produce that. Our office is an open door for all the groups who come every day to give us firsthand information about what's happening, to tell us about policies and programs that are working, and to find ways to engage. So I think through the auspices of the organization, we can get out that information and you can find ways to stay in touch. We are the central place in the State Department and in the government now in this big interagency process to move the Global Health Initiative forward. My office is working centrally on the maternal health piece. And so as we go forward, we are only going to be as successful as we have co-collaborators the world over to turn this into something that is meaningful in ways we have not yet seen progress on this issue.
I can't tell you, Ambassador Verveer, how thrilled we are that you are here today.
You know, she is just looking for ways to really make us all understand that she wasn't as persistent as she really was, and that she didn't do anything to upset my schedule, but I accept what you said.
Thank you. I have one just last very short question for you. I vacillate between feeling really depressed and pessimistic, hearing where we have been at Beijing and Cairo time and where we are now, and then becoming really optimistic because seeing you in this position and hearing your voice all over the world makes me really hopeful that something will happen. So if there is one thing, which is usually a very hard question, one thing that you really want to accomplish in your tenure, just one thing, and look around you. So this hall is not really full, but it has 17 disciplines and 32 countries represented here. So that one thing, how can we help you with it? Because we are ready to help.
Well, you know, that one thing is an unfair question because too often we have siloed the one things and gone after addressing the one instead of doing a broader integration. I would say that if I can leave whatever I'm able to do in the few years I have to do them, enabling the world to better understand and to make greater commitments to address the fact that until we invest in women, whether it's economic participation or access to health, we will not change the circumstances of our countries or of our world. And we have to see these issues for the central issues that they are, not the marginal category in which they are often put. And that is my goal, because if that is achieved, we will indeed see greater change.